Our next presenter is Doc Dominic Ligot. He is currently the lead data scientist of UNDP Philippines. His current work focuses on human rights, public health, food security, political risk, and fighting disinformation infodemics through the use of computational social science, social listening, remote sensing, artificial intelligence, and data engineering. Dominic founded Serolytics, a social impact data analytics company, and co-founded Data Ethics PH, an online community focused on social issues such as data privacy, data security, AI-driven discrimination, data liabilities, data ownership rights, and data poverty. Doc also co-founded the Analytics Association of the Philippines and is a board of trustee member of the Philippine Center for Investigative Journalism. He is here with us today to present the findings of the trends in COVID-19 vaccine acceptance in the Philippines and their implications on health communication report. Welcome, Doc Ligot, and the floor is yours.
Thank you very much. And thanks to all our panelists. Looking forward to our panel discussion after my presentation. Before I share our findings, I just want to preface and also echo Dr. Vergere's points that now is the time to welcome perspectives from a wide variety of fields. The work we do at Pintig Lab actually lies at the intersection of not just health, but also data, technology, and social science. And then, as you'll see in the next few minutes, all of these fields are very relevant with the findings we need to share today. So we performed an analysis of various survey data and also combined this with social listening to come up with answers or potential perspectives to the following research questions. First, we wanted to understand what are the trends. And I think most of this will be self-evident after Dr. Vergere's presentation. But as you see later, it's apart from the trend, it's really the nuance and the context behind the trends that will be very important to discuss today. Are there any barriers and facilitating factors to getting vaccinated? I think these are quite the quintessential challenges we need to face. Not a few months ago, we thought COVID was already coming to an end. No? In February, the trends were looking very positive. But then in a few months later, we're now beset by several new variants. And at the same time, we have a new player in terms of the way things are progressing, which is vaccination. And I think the preface here is COVID-19 continues to be a very complex situation. It's not something that lends itself well to one perspective. And if there's one thing that I hope you take away from my presentation today, it's the merging of multiple perspectives on the situation that we need to bear in mind. Are there any key segments to the target population for COVID-19? I think Dr. Vergere already alluded to this. Not everyone is encouraged to get vaccinated, but there are also a big segment of the population who are. And I think that's important for us to consider, especially when we're crafting communications. How do we not just address skeptics, but also encourage those who believe in vaccines to get vaccinated? And lastly, and this is a work in progress, are there any effective strategies for communication interventions? Communication is not the only tool at our disposal, but we believe in the Pintig Lab, this is a tool that we have yet to maximize, and that's really the crux of my presentation today. So before I dive into the findings, I just want to show the range of the data that we used. So we utilized the Facebook World Symptom Survey. So for everyone's benefit, this is actually a weekly data snapshot that comes from the University of Maryland. It's a regular survey being conducted by Facebook. It's self-disclosed. So they ask people, have you gotten vaccinated? And do you want to get vaccinated? And what are the reasons? The total sample size for the globe is around, by this time, about 250,000. And for the Philippines, it's several 100,000. And I'm happy to say that it correlates quite well with the survey findings from DOH, Pulse Asia, and Minda. Another thing you'll notice here is that on the fifth column, you can see that the hesitancy rates across all these data sets vary quite widely. And this is something that is a reality in social science, that you'll never have a full view of the situation. And the important thing is, how do you make sense of all these potentially varied and conflicting pieces of data in order to craft a concrete intervention? So what we have done in our study is we have taken pieces of information from all these surveys and put them all together. We will use mostly the Facebook survey to get a sense of trend because it's updated more often. But in diving onto the reasons for these trends, we will utilize some of the national surveys being conducted. Let's start with the good news. The good news is vaccinations are up. So everywhere you go in the Philippines, more and more people are getting vaccinated, and this is in line with the prioritization groups by the DOH. What we want to highlight here is, although the trend generally is up, there are some lagging areas. No? So these are not all of the areas surveyed, but you'll notice, obviously, NCR is ahead of everyone else. But there are some areas, for example, Western and Eastern Visayas, that are falling back. And I think that's something worth diving into when we try to understand the factors for this. More good news is, in terms of hesitancy, generally the trend is down, and that's also good. This is also evident in other fields. The more people patronize a particular product, the more other people will be more disposed to patronize it. And if you can consider vaccination as a product that we'd like to market, generally people are following the same trend. Now, this is where what I was saying about nuance comes in, because if we combine the two data sets, this is what it looks like. Although generally the relationship is negative, so the more people who get vaccinated, the less people are hesitant. We're not saying what causes what. I think it's really the sectors or the clusters and the nuances that matter. For example, on the lower left are people who, despite exhibiting lower levels of hesitancy, are not quite up there in terms of vaccinations. And then on the other hand, the upper right quadrant, you have areas where, despite a higher level of hesitancy compared to the norm, they're also getting vaccinated. So it's not necessarily a one size fits all compared to like upper left and lower right. And this is where the study that UNDP Pintig Lab chose to focus on. What accounts for all these differences? And maybe these differences are, a venue for us to craft interventions. So we looked to the MINDA, DOH, and Pulse Asia survey for this. In these surveys, they ask people if they had vaccines available, would they be willing to get vaccinated? And if so, or if not, what are the reasons? And this is a summary. I'll just highlight a few areas for ease of interpretation. So here in the upper left box, these are the top reasons people have stated the reason why they want to get vaccinated. And then here on the lower right are the top reasons for people who said they were either not sure or not likely to get vaccinated. What are those reasons? And I think this is very important for us to zoom in on, because if we look at everyone in the Philippines, it would be easy, it would have been easy if everyone thought the same way. But what we're finding from the DOH data is that there are actually very distinct segments, and not all of these reasons are present in each segment. So in our study, we found there's at least 7 segments in the population. I won't get into too much of the detail here. I encourage everyone to have a look at our report. But simply speaking, the first 4 segments in blue, these are the easy segments. They're the ones who already believe in the vaccines. They're the ones who are just waiting for availability or supply to come into their area, and they will be the first to line up. So the easy cells are the most convinced. They only have 1% hesitancy, all the way down to what we're calling the pragmatic segment. So they are willing to get vaccinated, but they're also concerned about lack of supply and perhaps a tedious vaccination process. And this speaks to, vaccination is not easy to roll out nationwide, and there will be areas where vaccination is harder than most. But it's good to see that even on a survey, we're able to pick this up. On the latter 3 are segments that are less willing to get vaccinated. So you have the complacent and the obligated segments. Generally, they will get vaccinated, but they will not be the first to line up. Particularly the obligated segment, these are people who said, okay, if my work demands it or if my travel demands it, I will get vaccinated. But it's also interesting to see the reasons they are probably not willing to get vaccinated, which aren't present in the first 4. Some segments, such as the complacent segment, don't even believe COVID is a risk. This is interesting from a literacy standpoint. Despite all of the overwhelming evidence of how dangerous COVID is, there are people who still don't believe that literature. There's also people who do not trust experts. And this talks to Dr. Vergere's statement earlier that Despite our best efforts, there's still an undercurrent of anti-science and anti-expert sentiment, and we need to think about how to reach them. And lastly, you obviously have the skeptical ones who have no reason to get vaccinated, and they believe all of the negatives, and they're probably the last, if ever, to line up. The last thing I want to highlight here is, as far as in terms of media use, not everyone is on social media, and that's, I think, something to think about. Where since the pandemic started, everyone has gotten used to working from home and having these video conferences and using social media as our main source of news. But what we're seeing from the survey results is there are segments of the population, especially the more hesitant ones, who are not reading social media. They're more driven by the traditional media like TV. And that means that a multi-platform strategy still needs to be in place. We cannot be doing everything on Facebook, Twitter, and TikTok. So how do we try to convert this insight into some form of intervention? And this is where we look towards communication science and technology adoption. So this is known as the diffusion of innovation curve. It's actually a well-established behavioral pattern. Anytime you have something new to adopt, for example, cellular phones, the internet, anything new that you want to introduce to a population, there will always be these 5 segments. The innovators and the early adopters are usually the ones who already believe the technology from the beginning. But to get to early majority, you need to cross what is known as the chasm. And that's where this webinar gets its name. And the reason for this is you won't get mass acceptance of an idea or a product until you hit early majority. And once you hit early majority, then you have this herd mentality. Maybe everyone will start jumping on that bandwagon. So what is the chasm? The chasm states that early adopters and innovators will be easier to capture because they already believe in your product. Some of them may have actually invented or driven that product, so you have no questions asked from them. But the moment you start crossing into early majority, you now have to start to address a growing reasons or concerns related to hesitancy. And I think this is where we need to focus on. Incidentally, the literature also shows that the chasm normally occurs around 13.5 to 15%. And I think based on the latest statistics, we're just about at that level already in terms of vaccination. We have about 12 million fully vaccinated. So we're about to cross that chasm, if not there already. If we overlay the 7 segments, it aligns quite nicely. So even though you have the first 4 segments who are generally willing, early majority states that we need to now address those subtle issues that the supporters and the pragmatists are looking at. And a lot of that can be operational, a lot of that is communication driven before we even get to the latter 3. We also attempted to look at the regional distribution. It also lines up quite nicely. But again, I don't want to oversimplify the issue. There's the presence of all these other segments within these regions. And I think that I want to underscore that even though we're looking at regional behavior, we need to dive deeper into each region and see how the distribution of these segments are in order to be more effective with communication. So that brings us to, I guess, the main crux of this presentation. COVID-19 is a health crisis, but it is also a social science problem because we're not just dealing with the progression of a virus, we're dealing with the progression of behavior. And that is driven not just by biology, it's driven by ideas. The WHO and the DOH use a framework called the BESD, or the Behavioral and Social Drivers for Vaccination. And this is actually a very practical framework because it looks at all of the factors that drive your intended behavior, which is vaccination. But in social science, we also know that the only thing you can really influence here are the practical issues. In other words, informing people where vaccine is available, making it easy for them to access, making it making it a preferred site. Basically, the logistical things, these are the easiest to influence. All of these other factors here, like motivation, what they think and feel, and social processes, are really very hard to change. They're almost a given. And this is why, apart from informing people how things, how they should behave, we have to also address the reasons why they choose to behave one way or another. And that's how this framework can work. And this is where we come back to our recommendation. The research actually points to targeted communications, and we can align these communications with the reasons that we have derived from the surveys. We are recommending at least 12 types of campaigns. These are not set in stone, but the idea we want to address here is we need to be addressing more than just the informative approach. We have to look at, as Dr. Vergera said, the thinking and the feeling, and then that leads to the doing. There's at least 3 types of emphasis here. The first is cognitive. This is addressing reasons that are more philosophical and more cerebral. You want to discuss, why is it important for you to get vaccinated? Or I think the bugbear in everyone's minds, this whole issue on side effects, just how significant is that? And how do you deal with the misinformation related to that? It will not convince everyone, but there is a sizable segment, particularly the obligated segment, who are usually highly educated, ironically. They're, masters, PhD people. They love to pour into medical journals and, and vaccine statistics. And they come up with reasons that people should not get vaccinated. So I think that's an important segment to address. There is evidence, overwhelming evidence that vaccines help, and we need to be able to drive that message. The second approach is more about managing fears. This is not fear-based messaging. This is about addressing people's fears. And the underlying principle here is, number one, we have to convince people that there is a threat. COVID is still there and it's still growing. But at the same time, give them the empowerment that if you want to control the threat, vaccinations are the answer. I think what you'll see in many communications outside of DOH is it's often just one-sided. People are either just talking about the threat or talking about the cure, but often this falls flat because if you just convince people that there is a threat, they get fearful. And if you just talk about the cure and people are not convinced that there is a threat, then they won't take action. So fear management is about balancing those two messages. And lastly, and I think this appeals a lot to the Filipino, we have to show stories of people who have already done it. We don't show this enough. We need to illustrate stories of people who have gotten vaccinated. And the good news is people are actually doing this on their own already, especially on social media. People are taking photos of themselves getting the jab. People who are saying, I didn't get any side effects. I think this deserves added attention because on the opposite side of the fence, you have people who are showing the opposite. People who are saying, hey, I got rashes or I got palpitations. And that also, creates kind of a negative sentiment. So we can use that underlying behavioral pattern. If we show more and more people getting vaccinated and basically surviving vaccination, it helps drive that behavior. So again, these are starter ideas. The point here is to do a multidimensional type of communication strategy. And in each region, it might be a varied combination of the 12. Another thing that we'd like to highlight, and we've been talking, with the DOH Health Promotion Bureau, is that digital data provides a lot of opportunity, to understand the ongoing challenges. And this framework is being used by HPB. They utilize a lot of insights and recommendations coming from social media and surveys, and they use this to guide policy and deployment, demand generation, and tactical communications. This is very important for us to reinforce. But at the same time, from talking on behalf of the UNDP and the Pintig Lab, there's a lot of opportunity we can bring to the table when we utilize kind of the wide variety of data that we have in social media. Right now, we're merely looking at demographic and psychographic data, and to a certain extent, geographic data. There's a wealth of information when we start mining opinions from social media. What are the trending keywords? Doing some network analysis on, Filipinos are by nature very cliquish offline. We are also cliquish online, and understanding who are the key opinion leaders and maybe enlisting some of them to help us. DOH already enlists the help of influencers. But at the same time, this has to be combined with community management on the ground. We also have social networks that are not online, and that's the opportunity. So I think I'm just about out of time. I want to, just recall, one of my early inspirations in my own careers, Professor Hans Rosling, the late Hans Rosling from Sweden. He's a professor of health. And he was one of the first in the health sector to say that data is often better than you think. I mean, we don't have perfect data, but data is there. And if we take advantage of it, you could yield other strategies and insights. And this is the time when multiple disciplines should be collaborating. It's not, as I said, it's not just a health crisis. It's a behavioral crisis. It's a social science crisis. And all this data can be used to various ends. So some recommendations in our report. First, let's acknowledge and congratulate the DOH for the positive trend in vaccinations. This did not happen in a vacuum, and it continues to improve. But at the same time, we still have those who are unwilling and undecided. Second, this is now the time, quoting the diffusion of innovation, where it will get a little harder to encourage acceptance if we don't understand the nuances between populations. So a one-size-fits-all strategy simplistically won't work. But at the same time, do we understand the drivers to make sure that the targeting is effective? Third, the BESD framework helps us with messaging cues that address all sorts of issues, whether it's fear, whether it's cognitive issues. And we need to drive that message further and then measure it using social and digital tools. Finally, of course, subject to logistical constraints, we also need to understand, are our communications working? And we need to also look at the enemy on the table. There are also people pushing anti-vax communications, and we should study how they're doing it and understand what they might be doing better than us and take advantage of some behavioral patterns they're using. And lastly, again, Pintig Lab is a data lab. UNDP invested heavily in this, and we're more than happy to provide that support to DOH, the HPB, and other collaborators. I think data is, I guess, indispensable, but we also need to filter the data. Everyone keeps saying data is the new oil. I also say data could also be the new pollution if we're not careful. So thank you very much. Hope that helps elicit a lot of good conversation, and looking forward to the insights from the